The VMS is spending a great deal of time trying to ensure that the Medicaid fee schedule is increased at least to the Medicare level. We feel this is critically important so that the new Medicaid beneficiaries continue to have access to the necessary health care services, particularly from pediatricians and those in independent practice. But it's tied up with the whole debate about the cost shift, and then ultimately how do you pay for that through the payroll tax. Those are issues that will be discussed over the next 3 or 4 months, but the VMS will continue to fight for the Medicaid increase.
A law passed last year required the Vermont Board of Medical Practice, the licensing board for physicians, to review its procedures for investigating unprofessional conduct cases. After considering input from VMS at its annual retreat in September, the board proposed some draft rules that address a number of VMS's concerns about the standard for board-initiated complaints as opposed to patient-initiated complaints, and notice to licensees, and when notice to licensees can be delayed. David Herlihy, the Executive Director of the Board of Medical Practice, plans to attend the VMS Council meeting on February 21st, Saturday, February 21st, from 9 to 11 at the Doubletree Hotel in Burlington to discuss the proposed rules, and any VMS member is welcome to attend. VMS is continuing to work to restore the funding for educational loan repayment in the governor's proposed 2016 budget. Please contact VMS to let us know how the proposed elimination of this program would affect your ability to practice in Vermont or your practice's ability to recruit physicians to work in Vermont.
There will be legislation introduced again this year to remove the philosophical exemption for immunizations for school entry, and the VMS, partnering with the American Academy of Pediatrics Vermont chapter and the Vermont Academy of Family Physicians, participated in a press conference, and we will be calling on members again this year to contact their senators and representatives, but we also need parents, so if you know of any parents that would like to participate, please let me know. S31 has been introduced in the Senate, and the Senate Health and Welfare Committee took testimony, a public hearing actually last night, and this legislation would require background checks on gun purchases, except for the sale between immediate family members and law enforcement armed forces. And it would also require that people who've been hospitalized for a danger to themselves or the public, or people who have been found not guilty for reasons of insanity would have to go to a national background check registry. VMS will be watching this legislation and will report back.